I watched the heart health and the nutrition video live streams. I was particularly interested in the heart health video because in Unit 2, the reading that we had, the training community health workers to be advocates for health promotion, it stated that compared to white adults, blacks are less likely to be aware of their cardiovascular risk factors and they're less likely to respond to the signs and symptoms. So I was really interested in the symptoms of cardiovascular risks. So the risk factors for heart disease that are controlled are high blood pressure, high cholesterol, and diabetes. Those were the top three. And the warning signs of having a heart attack was pain and discomfort or pressure on the chest, lightheaded, vomiting, and nausea, jaw, neck, and back pain, and discomfort or pain in your arm or shoulder. That is particularly for women. And then a shortness of breath. The doctor recommended that you know your numbers. So your numbers would be your BMI, your blood pressure, your fasting blood sugar, and your total cholesterol. He also recommends to just eat healthy foods instead of sticking to specific diets like the keto diet. He said that portion size was key and that eating fruits and veggies, you should always eat obviously more vegetables, and then to avoid sugar and salt. He also recommended that you get about 150 minutes of moderate exercise a week. And moderate exercise is basically good, walking and something that a normal, working person can do. I really enjoyed the part that he talked about the head and heart connection because I've struggled with mental health issues. Um, the research indicates that there is a connection, and he recommended that you embrace self care and life balance, and to also find a stress reliever. Um, in my head, I've never connected anxiety and the heart, but he made really good points of how if you think you have anxiety and you're not really sure, you should definitely get your heart checked out because of the fast heart rate that people associate with anxiety. Could just be a heart malfunction. With the nutrition live stream, she talked a lot about diabetes. She also spoke on the pre-diabetes, and she spoke on that it can be reversed with good exercise and a healthier diet. A third of Americans has pre-diabetes, and 9/10 of that third don't even know that they have it. I was really interested in the diabetes broken down by the race. First is Native Americans, then blacks, Hispanics, Asians, and then whites. Almost 200,000 Americans under the age of 20 have diabetes, and she really recommended paying attention to the labels and the serving sizes of what you're eating. And I have actually taken the diabetes assessment that she recommended, and I'm very proud to say that I'm doing okay for now. um, but I was really interested in the outreach that she talked about because that's just what I want to do in my line of field. Um, and so she talked about food insecurities and how it relates to diabetes because generally people that don't have a lot of money, they can't afford, fresher foods. And so they go for what's cheap. So she talked about the mobile food that they have in the reading from Unit 2, the community-based participating research. It said that stressors in the social and physical environment are associated with poor health outcomes, which that's pretty much evident in the fact that food insecurity relates to higher levels of diabetes. I also like the action based labs that she had in classroom in order to get the kids moving. And it's so hard to tell a kid to sit still and to listen. So I think it was a really good idea for the action based classes in Pasadena ISD.